without the knowledge and the experience and the expertise to know what's a hallucination, what piece of information is actually accurate, then you're kind of left like block of text. Spin the wheel and choose which one is hallucination. You might not know.
So it's not going to provide great information if you don't provide it specific information in the first place. The model and the AI is learning off of your personal information because you're putting it in there.
Don't feel that you have to use these AI tools, and don't feel that just more information is always going to be better for making health decisions or nutrition decisions. We have seen this as an issue in other professions where people like lawyers will be trying to speed up their research a little bit and using these models to help them to look for related cases for what they're working on, citing fake cases that don't exist, and then having professional conduct issues. You still want to ensure that you're practicing within the bounds of your competence, and if you're trying to learn something new, ensuring that you're confirming this information, because you don't want this to be an issue in terms of security or other ethical guidelines.
We're going to talk about the do's and don'ts of AI and nutrition and lifestyle. So we hear a lot of people talking about using different AI tools like ChatGPT, Claude, Gemini. There's others now for health related things. So what we want to go into today is talk about what you should do, or not what you should do, what you could do. What are good uses of AI in this space, and what are some uses that are probably ones to stay away from, maybe one or ones that you could use it for if you have the knowledge and skill in order to navigate it appropriately. So hopefully we'll, coming out of this episode, have a decent list of do's, don'ts, and perhaps maybes. And we have two dietitians here. We have two nutrition experts in the room. We also have an AI tech expert in the room. So hopefully with our three brains together, we can come up with something that the people listening / watching can actually take and run with, at least where we're currently at. This time next year, this conversation is going to be completely different, but we'll see where it takes us for today. So shall we do a quick recap on where we began this conversation last time, just to set a little bit of the stage?
A quick recap is, well, we started off with what is AI and what tools are we talking about mostly here. And these days when we're talking about AI and these tools, we're largely talking about large language models and large, Brandon already referred to a couple of the bigger ones that are being commonly used. So that being Gemini, ChatGPT, Claude, DeepSeek. There are a few others here, but they all kind of have generally the same ideas and structure, and people will be using them for much of the same purpose. And last time we were talking about, can AI replace healthcare providers? And we said a big takeaway there was having that human in the loop. So right now, at least, AI hallucinates, so it comes up with some things. And so healthcare providers and experts need to look at the output before and interpret it before providing advice back to people. What does that mean from an end user if you're just directly interacting with the chatbot or with this LLM and this AI? Well, there are a few other considerations that we'll dive into, but I think, does that give a good overview? Do you guys have anything to add on the overview?
No, I think that's a pretty good overview. If you haven't checked it out, go check it out. It'll be linked somewhere in this vicinity, if you want to learn more about it. But I think that captures it really well, and that's kind of why we started with that when we talked about can it replace healthcare providers? This is basically, if the flip side of that question is can people use AI tools on their own without healthcare providers? Is that interaction with the human still required? Yes, no, in which contexts? And I think the key piece that you mentioned is that there is going to be some instances where AI tools hallucinate, meaning that it provides information that it's borderline nonsensical. But the thing is that much like if you're talking to any humans online, this is there's so many similarities here. If you're looking at information online from a human and you take what they're saying at face value, and be it a blog, a video, TikTok, Reel, Instagram, wherever it is, you take what they say at face value. Most people aren't, if they can tell the difference between what is correct and not correct and the nuances there, they're going to tell you. But some people don't want, for whatever reason, they're not going to say those things. They're not going to say, I'm providing you with some misinformation here that I have no evidence or base for. So just so you're aware, these next statements are going to be probably incorrect. So you completely disregard them. Like it's humans wouldn't say that. An AI tool wouldn't say that. So you need to be able to tell the difference. And that's where things get a little bit dicey. Hence why we wanted to have this episode to begin with, because without the knowledge and the experience and the expertise to know what's a hallucination, what piece of information is actually accurate, does not even getting into like how the information is handled yet. Without that, then you're kind of left like block of text. Spin the wheel and choose which one is a hallucination. You might not know.
I mean, then that's a good point though, because that just some of the principles we talk about here and how we do's and don'ts of using AI kind of come from some of the do's and don'ts of just gathering information from the internet. And is it evidence-based and not? And I even do this with research articles, is I don't, unless it's a research article that has, or a source that has a lot of credibility behind it, has a lot of discussion references behind it, and has been, referred a lot or cited a lot, then that's not really something, I'm not going to take that, even a peer-reviewed research article, I'm not going to take that right at face value. I'm going to look for other sources. And I find when I'm searching the internet, I'm going to at least look at at least two sources from reputable sources. Then I check if they're reputable or not too. So you get kind of like in this endless, rabbit hole. But either way, I try to find two reputable sources and cross-reference them to get a better idea of something that I can trust, right? And that's the biggest thing when you're talking about do's and don'ts of anything you're searching on the internet or anything from output from AI is, can you trust its output? I mean, with internet, you would, or with blogs and other information you find on the internet, that's just, like I said, you would cross-reference it, you would check it. So I think some of those principles could be applied here too, although there are some additional things that we want to bring up that we want to consider. And did you want to kind of dive into that now, Brandon?
Yeah, but before we do, Matthew, anything you want to add?
Yes, I'd like to add that one additional consideration we need to consider when using some of these large language models or other forms of artificial intelligence for health information is, again, recognizing that based on what we discussed in the first episode in terms of how this information is gathered and collated all together, it's very generalized. So we want to consider with these outputs, does this really apply to me specifically? Is this really correct for my situation, which may be influenced by chronic health conditions, cultural context, even just like food preferences, my daily schedule, things like that? Because with how this information is just gathered from all over the internet, it has to be quite generalized and not specific to you. Similar to how even us as registered healthcare professionals, if we're writing something that's more online content, it has to be more general because it's for a general audience. That's why, some of this information you may find is more generic in nature or less applicable to you in nature, or in addition to some of the issues we mentioned with hallucinations or just generally incorrect things.
Yeah, I think that's a really good start, really good point to make, is that it's only as good as the information you put into it, right? That goes for any AI you're dealing with. So it's not going to provide great information if you don't provide it specific information in the first place, right? To allow it to even kind of narrow in on the advice it's providing you, or the information that it's providing you, essentially. I think in addition to that, taking a little bit of a step back, is there's some inherent considerations of just using LLMs generally, even before you get to the point of trusting its output. And first of all, there's the privacy and security considerations, and that is, you consider where these models and where that data resides and what they're doing with your data too. So you got to think about, I'm putting this data in here, what happens to it, and what are they going to do with it? In ChatGPT's case, the default, and in actually most models, Gemini, I've seen this across pretty much all of them, is they're going to keep that data. But they're not only going to keep that data, is they're going to use it to train the model and make the model better for everybody, which is fine. I mean, that's a great thing to do. But you got to keep in mind that your personal information is going in there, right? The model and the AI is learning off of your personal information because you're putting it in there. And even if you turn off the training, a lot of these companies and these models, they keep the data for a certain amount of time for debugging issues and checking out making sure the AI is working as expected. They still keep that data for 30 days. And right now, depending on where the data is actually kept, is it ever deleted? We're not entirely sure. And in some cases, it never is. They just say, you can just say it's not used to retrain a model, but some of these companies, they keep that data forever, right? And who knows what they're going to do with it after that. Double check the privacy policy and everything to make sure. But when you're using these models or using these services, do check that, first of all, from a privacy and security standpoint, and be careful what you put in there.
I was right on that note. Actually, this is one of my favorite things to do, because if you're thinking of the average person looking at privacy and security policies, first off, if you can even find them. I mean, if you go to a website's main pages, if you scroll to the very bottom, most of them are going to have terms and conditions, privacy and security policies. At least the privacy policy is going to be there, or the help section or the FAQs. But there's a lot of legalese in those policies, and so if you the most, now of course there's always an element of like, make sure you read it yourself, but one of the things that I have found helpful is identifying which areas of those policies are relevant to this particular thing. How's it handling information? How long are they keeping the information? What are they doing with the information? Can I control what they do with the information? I will copy their policy, put it in that same chat bot, and say, tell me about how it handles information that I put into it, how long it keeps it, what it does with it, blah, 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 and like summarize those points at a high level, and then indicate where on the policy those were, if that would be a knocking down a barrier to you actually going to look at that information. Because most people don't, like, they just, you agree to our policies when you first make an account, check, accept. Like, I would say most people don't actually read the thing, and it's because, one, it's so damn long, and two, it's full of legal terms that most people it's not exactly light reading. So using the AI tool to summarize it can be actually helpful. It's kind of using it on itself.
No, I love that. I think that's a great way to dig into it. Of course, it's like trusting the output, but we could go in a loop there too. But still, it is interesting use of it, and I mean, you're still checking that privacy policy and asking it to point out those things. So that's great. And nowadays, they usually do show the references. So that, I think that's really, that transparency is absolutely needed in moving forward with these AI models. So keep that in mind, though. The other aspect of this is, and this was happening with earlier models, I don't know if it happens as much now, but some people were putting some really confidential information into some of these earlier chatbots. And what would happen is that this confidential information would suddenly show up in somebody else's chat, like some financial information, or some in the software development world, there would be keys in there. People shouldn't be doing that, right? And then all of a sudden that stuff would show up on other people's output, and they'd be, this is weird, and then they could use that and exploit it. And so that's another consideration when you're using this, and considering the information you're putting into the bot, and trying to make sure that it's kept safe for you and it's not sent out to anybody else. The other key consideration is bias. So Matthew, you already talked about how like it's generalized, and it's about the information you put into it to get the good output, right? But also, each of these models is trained off of various data sets and various different data sets. And so they all have a little bit of existing bias, no matter what you do. This, and going back to Brandon's examples, is humans have this too. We are only biased based on the information we've been provided in our entire lives, right? Anytime we make an interpretation or provide information, it's based on our experience, what we've stored in our brains. And so that's essentially what's happening with these models. Is anytime you can't expect it to be providing the perfect bias back to you, or the perfect information back to you. It's going to be biased based on the information that it had previously, or it's been trained on. So you need to consider that too. So that's why you need to be cautious when looking at these outputs for a bunch of different reasons as well. Those are kind of like the overviews of potential do's and don'ts of using AI just in general. But I think there are some other considerations for using it with nutrition and lifestyle, which I'm not an expert of. So
before we get to the nutrition specific side of things, I also want to expand on what you were saying there about the keeping data confidential aspect of this, where, of course, yeah, you don't want to put in your personal information into these large language models because, again, you don't know where it's going. You don't know the policy of every single one. You don't know if those policies may change over time and such. But this also applies to healthcare providers, where you don't want to put the confidential information you have of not just yourself, but in this case, other people into those machines for the same security reasons. And also, if we are using it to assist ourselves in our work, we are, as we said, wanting to check the validity of that information, where we want to ensure that we are providing, if you are needing to search something, ensuring that it's using reputable sources that are medically backed, and it's going to provide the best information for you to then provide care. And with the issues with just the information accuracy, we have seen this as an issue in other professions where people like lawyers will be trying to speed up their research a little bit and using these models to help them to look for related cases for what they're working on. And this has been a major issue when it comes to hallucinations. And you may have seen some of these in the news where people in the US or one case in BC are citing fake cases that don't exist and then having professional conduct issues. If you're a healthcare provider, you also want to make sure that you're not violating any of your own ethical standards, whether that be not handling this information securely and properly by, again, putting information into these machines that you shouldn't, or maybe you are not using evidence-based practice because these things are telling you certain things that may or may not be true. So you still want to ensure that you're practicing within the bounds of your competence. And if you're trying to learn something new, ensuring that you're confirming this information because you don't want this to be an issue in terms of security or other ethical guidelines that you need to follow there.
Even for some, I remember it's whether I'm just getting better at using the tools or the tools are getting better. It's probably a combination of both. But I remember like even this time last year where I was experimenting with using ChatGPT as a way to generate information, and also I was prompting it to try and cite peer-reviewed literature for each of the claims and pieces of information that it was providing me with. And you click into those links, and the metadata that was in those links appeared to be correct, or the meta tags appeared to be correct, like the title of a legit journal, the journal article itself, and then you go click into it, you look at it, and you're like, this has absolutely nothing to do with the output that it provided or the topic at hand. Like, it on the surface looked like it was going to be, and then it's just the link was something completely different in a different journal, like topic not even relevant, like, and it was some like I don't know, chemistry thing or biology thing. Like it wasn't nutrition, that's for damn sure. So that happens less, but even so, like providing with citations, like of course having that there is good, but I find it's better now, but it still happens. And again, you don't know when it will or won't. So vigilance is always a good thing because, and at least in our position, when we're working with humans and handling information and providing guidance to people, I mean, we have an ethical obligation. Some professions don't. And of course, individuals doing stuff for themselves can kind of, whatever the consequences are is kind of in their own space. It's not like they have a college or regulatory body that's going to come knocking on their door if they put something in an AI tool and they put confidential information in there. People can do whatever they want with their own stuff. So it's an interesting to hear, even in other professions, that it happens, and it's like I I feel bad for the first person that got caught doing that crap, because can you, like, nobody wants to be that person that is that first person that did something like that, and then now it's news, and now it's like the precedent for the dumb stuff you shouldn't do. Like, that sucks.
Yeah. I mean, we'll see the models get better and better. So hopefully we can start to trust them a little bit more, but that's years away. And a lot of more of those are going to keep popping up. And you can see why where the LLM gets that from. I mean, it's just pattern recognition. It's recognizing words and phrases you're saying and matching it to things that it's memorized. And so it's not evaluating, in a lot of cases it's not evaluating what it's providing you, and in some cases, even if it is evaluating us providing you, it might gloss over that because of what is in its brain, is what the patterns it's recognized in your language that you're providing it. So yeah, you can see how it gets there.
Pieces of other things that have come out more recently, and I mean, we're still kind of, in terms of the literature and uses of artificial intelligence in the nutrition, lifestyle, health space, and long-term effects of its use in different contexts, at least with having the public's hands on a lot of this, it hasn't been a thing for so long where we know the long-term implications of a lot of it. Like, are using these tools actually beneficial? I mean, you can get information from it, but is it actually in your best interest with your health all around? Like, thinking of long term, I've seen some things, haven't dug into it yet enough to know if it's legit or not, or if there's anything there, but looking at the effect on the brain of using AI tools for, learning purposes and to handle work and tasks and things like this. Is it helpful in the short term so that you can do more and you can find more information quicker? Is it good in the long term so that if you're actually trying to learn and build skill and knowledge and expertise in a thing like some nutrition, health space, lifestyle space, so that's ultimately what we care about, is helping people build confidence, knowledge, skill to be able to do things on their own and not have to rely on tools to do 100% or at least the majority of the work all of the time without engaging their own minds in the process. That could be a little bit dicey, but we don't know quite yet what the effect of that is.
Yeah, it's interesting you bring that up, but I think that's a whole nother discussion of the long-term effects and the long-term effects and the loss of skill. But I think that's a whole nother discussion. And but there are some tools, I think, that AI currently, that the current versions of AI, I think there's some things that it does well, some limitations, and some things where it can help you.
Well, why don't we start diving into some of those points? We kind of already talked about some of them. I think if you're thinking about dues, understanding how your information is handled by whatever tool that you're using is a good key, and taking some time to understand that. Obviously, everybody's a human and has full agency over whatever you're doing with your information, so you can put it wherever you want. But if you want to do the right thing and make sure that your information is handled in the ways that you want it to, check into that. Check into the settings of whatever tool that you're using. My top tier pet peeve that I have discovered now is that, at least in its current state, Gemini connects the chat history with its setting for using AI for training its models. Like if you want to have chat history in Gemini currently, at least for the free versions, I haven't looked at the paid versions. To turn it on, you have to turn on sharing the data with its to be able to train its models. If you turn that off, you turn off chat history as well. Like those two settings are connected with each other. It's the dumbest thing ever. That's a side. That's a side tangent. I won't go down that rabbit hole. All right. Why don't we let's talk some specifics here. Matthew, want to dive into some of them?
So when it comes to using AI tools in the realm of your personal health and nutrition, there are some key points that we want to consider throughout that process. So one is going to be recognizing that, yeah, while it is convenient and can be used effectively, it is still a more supportive tool or in a supportive role. So it's not something that will replace entirely something like expert care. It's not something that will replace entirely the effort on your part. It can add additional efforts that are required for assessing this information, as we've mentioned a few times. So knowing that, yeah, can be helpful, but it's not going to be everything. It's not going to be all you need. Another consideration is that it is going to be something that maybe you are getting it can be helpful for more like starting stages of just knowing more at a basic level what may be helpful in a certain situation, may give you some good sources to look at to learn more about a particular topic. And I think that that may actually be a better usage than a lot of others, where you are still taking the time yourself to actively engage with the information and to learn about a particular topic. You're able to assess and look at the sources that it's providing you, see if the links are even valid, see if the pages say what it's saying in its summary, and also engaging in that learning process yourself, where it's not so much just a replacement for that. You're still critically thinking, critically analyzing the information yourself, and still an active participant in the process. Again, it's more of like a partnership or more of a support. It's not taking over everything for you. Other things to consider as we are wanting to use it wisely, or other things to consider as we are trying to use AI wisely for nutrition and health purposes, is that as we described it as more of that beginning role or supportive role, there are potentially still going to be times where you need further clarification. And in that case, then it can make more sense to then consult a dietitian or other qualified health professional for tailored advice. It can be very helpful for that more beginning, simpler stuff, but at a certain point, things like your own research or things like tools like this are going to no longer meet the needs that you have, and you're going to want to go to another level. At that time, it may be better to then see a registered health professional. And this can help make those sessions more meaningful, more helpful. And if it is something like a paid service, just a better use of your time and money, where we get the basic stuff out of the way yourself beforehand, and then we build on that together in sessions with a qualified professional.
I think that seems like some great advice. So would you say then the best use for these tools when trying to when using it for nutrition and lifestyle is, I mean, you said more like a partner. So is it like helping you brainstorm, helping you learn about things? Would you say that's kind of the overarching point?
I would say it's mostly the learning piece, where let's say I have maybe you're recently diagnosed with a certain condition, and then you ask it to find you some reputable resources on that particular topic. It can then list you out a summary of key points from each source. You're able to click it and verify and learn. And if you recently developed or were diagnosed with a condition, it's important to learn what is a level that's understandable what's happening in your body and what care might look like, because this may change the next short amount or long amount of your life. And it's good to be informed about what's happening and what you'll be needing to do. And these tools can help with making that research process more efficient, so that maybe you have some information going into things with a healthcare provider. Maybe you have some information on what you can do now. It's great for that, I would say. Again, as long as we are looking at those sources. So this isn't a replacement for research, but it is making that research more efficient and providing you more reputable sources as those links are open.
Mhm. I've found a decent use of this with some folks in that context for specific conditions. One of the things that I found in some areas is that the available information for something like a chronic disease, chronic condition like diabetes or heart disease, like there's a lot of information on many websites that are reputable for this, but the way that they present the information may not always be the best. It may be formatted weird. They may have these like guiding principles or professional practice guidelines or things like this, some of which they'll publish public versions of these that are in more simpler terms. But one way to go around not feeding certain tools your personal information, I've heard of some folks that have actually taken their blood work and put it into an AI tool and then told it to like what interpret the results for me. If you That's dicey. Rewind 10 to 15 minutes and see the answers we gave about why that's dicey. But if you have information in a location on a website around a certain condition like diabetes, for example, and you take that information and then perhaps you either take one of the files that they provide you, that website provides you, like a PDF, or you copy a big block of text from one of the web pages, and then you copy that, paste that into a tool, and ask the AI tool to summarize it or put out some key points for you. That'll at least give you starting points to know where to look forward. If you're having a common thing people run into is that they're like, oh, they're so overwhelmed with like all of the things that they could be doing. Where do I start? And so helping to prioritize things, at least in a really simple way. Now, how far it can go into personalizing exactly what the priorities should be, take that for what it is with a little bit of a grain of salt. And don't give the blood work results a common thing. You'd be like, use general terms like high blood sugar, or maybe you give a specific number, but you don't upload your results as a whole, because then there's just numbers at that point. So be more general and more basic with it so that you can still at least know which paths to walk to get to the information you're looking for without actually giving every piece of information about you to whatever tool you're using, be it ChatGPT or whatever other AI tool. There's ways to get to the point you're hopefully getting to without providing very specific personal information, because it's just a concept at that point.
Exactly. I think that's some good advice. I mean, despite our cautions, we talked a lot about those kind of don'ts and cautions. I mean, these are amazingly powerful tools. They can really help you help move you along your way. So do take advantage of them because they're so ubiquitous these days.
Another thing that I've commonly recommended to people that I feel like is pretty low risk is more practical components of nutrition and lifestyle. So if you're looking for ideas for how to prepare a certain food, obviously there's a caveat there. Depending on what food it is, you got to maintain food safety practices. But if you're like, I have these apples in my fridge and I want to use them for a bunch of stuff, can you generate me 5 ideas that I could use these apples for? Instead of going to Google and trying to search recipes, and that can be a frustrating process. If all you need is a canvas for generating ideas for something, because coming up with them and sitting and staring at a wall trying to think of them from scratch is really difficult, aka that's me. I will stare at the wall continuously. But if I have something that's like, oh, you could do this, 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 and this, and you're like, oh, right, I forgot that applesauce exists. Let's do that. that's a great use case. Very low risk. There's not much that really bad can happen about that. At least in my opinion, I haven't seen it in comparison to other like more specific health condition-y type things that you need additional information like what are your blood work result, like you're not going to do that. So in my opinion, I found pretty good success of generating those more practical hands-on type things. uh, of course more specific to the nutrition and in diet space, but I even in the realm of general lifestyle elements, generating ideas, coming up with good options for things just to kind of give you something to work from and then you take it from there, I found is a pretty good use of a tool like this. Any other key things that either of you can think of that we may have breezed over or didn't verbalize yet with some do's and don'ts using AI for nutrition and lifestyle?
Well, I think a do is use it as a partner. It seems to be I find it's a great brainstorming tool, especially in the use case that you've provided there, Brandon. I mean, brainstorming on ways to use the ingredients that you have with you or things that you like. So I think that's a great do. Maybe a don't to go along with it is be very careful with providing it your personal information and it'll be a fine line of trying to, get the best output from the bot by providing it as specific information as possible while not providing it your own personal health information. So I think there's a couple do's and don'ts there from me, at least, that I've gotten out of this.
I think one don't that I'll finish off on is don't feel that you have to use these AI tools and don't feel that just more information is always going to be better for making health decisions or nutrition decisions. These tools are useful if they're used for the right thing by the right person at the right time, and not all of those may be the case for you right now. So you don't have to use all of these or any of these. It's finding a tool that maybe it's identifying what need you have that hasn't yet been met, seeing what tool can be used to fill that in, whether it be an AI tool or something else, testing it out, and then seeing how it goes, not just seeing the tools and then trying to tie it back to something afterwards.
That's a good one. I like that one. Yeah. Don't just use a tool just to use it just because you feel like you should use it. Use it to solve a specific problem. Use it to solve or provide you with a specific benefit. And I hope that AI tools won't become the next MyFitnessPal, where it's like you're not winning if you're not using this thing. Like it's nonsense. So I think that's a good one to finish off with.
Yeah. Unless you're in software tech, which I mean, I'm going to use AI for everything. That's just me, though.
I mean, once you find a good use case, it's kind of hard to let go of it. That's a good point. Yep, that's a good point.
Yep, using things for funsies or for work is different than just feeling that you have to use it for a purpose. If you have fun just trying stuff out, that is different.
All right, Nathaniel, thank you so much, man, for joining us again. It was a blast to have you. Hopefully, we can find another topic where we can bring you on again in the future at some time.
No, this is awesome. I thank you for having me for these couple episodes. Looking forward to joining in the future again. I learned a lot.
Happens all the time. Alrighty, folks. That's it for our episode for today. Hope you enjoyed. If you got this far, thank you so much. Make sure to share, subscribe, do all the things that you would do. Check out our episodes. If you didn't check out part 1 of this little mini series on using AI in the health space, please do that. For now, we hope you have an excellent rest of the day wherever you are, and we'll see you very soon in our next episode.